talking right now. So I'm going to do my best to summarize what we heard this afternoon so that we can all leave with a organized summary. Right after lunch, we heard from Jacob Williams, who told us about the PECAN study, really emphasizing better understanding values of participants in public health research, understanding that these insights to perceptions and improved communication between researchers and community members are essential to the work that we do. And we really need to engage with community to understand the community, and only then can we truly serve the community. We then had this incredible community panel. So I just thank you so much for everyone from the community panel. I heard so many great one-liners that I'm going to store, not for the community, with the community, right? Also, we need everyone at the table so all voices are heard. And I think we've heard that before, but I've never heard, but we need to know you exist, right? And so if you're not at the table, we're not going to hear your voice. And if we don't know your voice, people don't know you exist. Barriers exist. We recognize that, right? There's discrimination, stigma, legal issues, privacy issues, but we can overcome those barriers if we work together and we utilize the strengths of everyone. So find what the community needs to encourage participation, understanding that might be different for different communities. So I think it's really interesting. I heard parking, validate parking, offer food, access to care. I've heard child care, financial compensation, but you need to know what people want to bring them to the table, and that's going to be different for different people. And the researchers we talk about these ivory towers. We can't sit and ask people to come to us. We need to go to the community. We need to build their trust. We need to learn their wants and the desires. And going into the community, I've heard about the church. I've never heard about going to the club. So not sure if I'm there yet, but I can try. Utilizing social media and speaking their language. And I think that's both from a linguistic perspective of speaking language, but also understanding where people are coming from so you can speak at their level. We need to promote health literacy, and I love the idea of part of community engagement is also the promotion of self-advocacy. We need to teach these communities how to advocate for themselves so their voices are heard. Find clinic champions, find survivors that can tell stories to promote prevention, build partners, use each other's strengths. So that community research board gave us a lot to think about, and I think a lot of little nuggets to take home. We then had Kristen Lancaster talk to us about rapid genome sequencing, rapid exomes and panel sequencing. It's increasing all over the clinical genetics space. This testing leads to more timely diagnosis and changes to management. But remember, don't do this without the help of your friendly genetics professional. We then heard from Alistair Warner, who talked to us about community-based participatory research, incredible work that's being done there. I think we all know that we're improving the health for research participants, but really thinking, are we increasing the overall community health for individuals that are participating in the research and their local communities? It's really important for us to remember that a lot of these standards that we've set are based on urban academic settings. And so when you're going into the community, you need to remember that these communities might have different levels or perspectives or standards that we need to meet when we're engaging with them. Really cool stuff around data cleaning, revisiting standards, allowing each experience to remain in a data set and not excluding it. So being more equitable and responsive with normalization of interpersonal variation and means. Really neat stuff. I don't think I can do it. Really glad you're doing it. But I love the idea that this secondhand health information is shared, and this can lead to increase in healthy community practices. We then heard from Pamela Genschow, who talked to us about universal hereditary cancer risk assessment, thinking that we need to promote equity in the genetic testing space, and that sometimes we're lagging in implementation in primary care. So how can we do this? We can embed risk assessments with equitable access. Getting a family history in 4 minutes is very impressive. As a genetic counselor, no way I could do it, but really glad you guys are. Also really neat to see that, when implementing something like utilizing a risk assessment tool, that the process was followed and areas of drop-off were seen. And so then they readjust it by a new process, test my genes. And also really nice to know that before we go and implement something into a group, we need to get their perspective. So getting the actual voices of the FQHCs, they know that they're going to face some barriers with clinic workflow and resource referrals, but knowing what those barriers are is going to help us overcome those barriers together. Also knowing that the Cancer Genetic Services, there's barriers there, but they have the space, and that these things are achievable when you recognize what they are and you work together to overcome. And then we just heard from Jada Hamilton, who did a great job telling us about mainstream models in hereditary cancer. I think we all have to rethink that traditional genetic counseling model. These point of care models are gaining a lot of traction, and really neat to hear that their study showed that patients respond to this with high acceptability. You know, the sample that was looked at was satisfied with the pretest education and their testing decision. There was less anxiety and depression around these results in this process. There was a slight dip in knowledge, but again, that's something that they were able to overcome and that knowledge increased with the genetic counseling services post-test. We then heard about the Imagine study, which was adapting the model previously utilized to be linguistically and culturally appropriate. The test education material development process was incredible to hear about. I love the idea of translation and transcreation, and then also making sure you get the perspectives of the individuals once those educational materials have been gone through this kind of recreation process. And we look forward to seeing the results of the randomized controlled trial to evaluate this model versus standard of care. We did it! If you had fun today, if you learned a lot, please fill out this evaluation. The evaluation will help get feedback, make this conference better, continue to get this conference funded. So please fill out the evaluation. It'll be really, really helpful.